Hello everyone and welcome back to my channel. If you're new here, my name is Nurse T. I'm a registered nurse and I have experience in various fields, including but not limited to home health care and Today, I'm excited to talk about my role as an assessment nurse, what is involved, and the importance of it in the healthcare field. Okay, so Nurse T, why assessment nursing and why is it important? Well, if you don't know, if you're new to my channel, I am a registered nurse who also work in the hospital. In my years of experience of working in the hospital, I have shared with those who I precept the importance of actually performing in a thorough, basic head-to-toe assessment. The reason for that is you want to establish a baseline. Anytime it's your first encounter with a patient and the plan is for you to monitor this patient throughout the time frame that you're going to have an encounter with them, it's important to establish a baseline. Just to give you a brief example, when I work on a neuro floor, I've noticed that in order to determine if a patient is having physical changes, or you definitely want to make sure you establish what is normal for them in order to see what is not normal. So if you have a patient who presents to you one day with slurred speech, drooping of the mouth, tremors or anything, if you don't know what their baseline is, you wouldn't know if that's something new or if that's something that was previously there. So it's very important to establish a baseline when you come encounter with a patient that you plan on monitoring either for 12 hours, 24 hours, or 24 months. So in this vlog, I'll cover what an assessment nurse does, how you can get started, and what skills you need to excel. So if this is something that if you're just an aspiring nurse that's interested, or if you just kind of want to know, hey, let me see what assessment nursing is about, stick around. I got you covered. Without further ado, let's just dive right on into it. Number one, what is an assessment nurse and what is their role? So an assessment nurse is responsible for gathering the client's physical, emotional, social information that is needed to formulate a personal plan of care. Okay, so as the assessment nurse, you will ensure that the patient receives the right level of care, whether they're at home, at a facility, or if they're in any specialized programs, such as like the day hab programs or adult daycare programs. So far for me, my encounter with using my skills as an RN assessment nurse, I have been a contract worker for a daycare, an adult daycare facility. And with that particular role, what I would normally do is I'm often called when there are new clients joining that facility, and those clients have to be assessed by a nurse. So I go in, I take the client to a certain area, and I do like a head-to-toe assessment. I check vitals. I look at pertinent things such as like just the normal, what you would need, like if they have any vision impairment, any cognitive issues, any currently in any respiratory distress, any issues as far as not being able to have like all their teeth. Do they have the dentures that they need so that they are, are they at risk for aspirating? Are they coming to me swollen, looking like they're not tending to whatever medication regimen that they need to be on to eliminate increased swelling? Just different things like what I would normally do in a hospital. I basically take that into the field and I'm thoroughly assessing these clients so that we can see what their baseline is, so we can know whether they are improving or whether they are declining, and if I need to make recommendations, like if the patient is at the day hab and if they belong to a group home or a personal care home, I can make those recommendations so that they can follow up. Or in that instance, I can even follow up, because it's important that I have the client's information, such as their doctors, when was the last time they've been to the doctor, what's the most recent current reconciled medication list. I have to make sure that these clients are typically being taken care of at their facility, so that when they come to us, they're in the best state to receive like the best care while they're away from their primary place. So those are a few things that I do, just to sum it up. So how can I become an assessment nurse? Well, for starters, you need to become a nurse, right? So as an assessment nurse, we all know that RNs typically do initial assessments. So you do want to complete a RN program, be it a 2-year or 4-year program. You get your RN license, and then from my personal recommendations, I would recommend that you get experience with doing assessments so you could become very familiar with it. So you can become familiar with what's normal, what's abnormal, and what you should be reporting. So yes, I would definitely say become a registered nurse first. Get you some experience. Having experience in case management is also great. Having experience with thorough assessment. Most of the time you can have a lot of experience by working in hospitals, nursing homes. And if you're going to be assessing the elderly, then it's good to have experience with gerontology, helping those of advanced age. And likewise, if you're going to be an assessment nurse for a pediatric client, it's great to have experience working with pediatric patients. You have some that are not as critical, like I would say kind of sort of the normal ones, and then you have the ones with diagnosis of, the common childhood illnesses that they may present with. So having experience, if you want to be a pediatric assessment nurse, definitely have some experience in pediatric care. And I will also say having some certifications in those areas. As you all know, that I was board certified in medical surgical. So I definitely have an eye out for basically just looking for like the disease processes, and just kind of knowing as a registered nurse, what are my interventions that I can do within my scope of my scope of practice. And then I also know what is beyond my scope of practice, what needs to be escalated to the medical director. Okay, Nurse T, what can be some challenges of the job? Well, for me, for starters, one of my goals every year that I work on is just being more organized. So I would just say one of the challenges is just staying organized. Number one, you're dealing with multiple clients. You want to have some type of structure of how you're managing these clients, especially if you're going to be working with having different contracts with different agencies, because you do have some assessment nurses that are hired on for that facility, and then you have some that are just contract into that facility. So I would say being organized and just being able to deal with the challenges of speaking with those clients who are not always able to speak back to you correctly or clearly. You have some that have some aphasia, or they just have some issues with speaking in general. They might have some mild speech impairment, or some of them are nonverbal, and just being able to get as much information as you need to thoroughly complete your plan of care. So Nurse T, what are some rewards on doing this in the community or wherever you may decide to fulfill your role as an RN assessment? Well, one of the rewards for me is I love being able to have a major impact on those who often might come across others who are not as compassionate, with what they do. I love what I do as a registered nurse. I get that a lot, that I show a lot of compassion, and yeah. So I typically, they always say, if you love what you do, you never work the day in your life. Well, to see the smiles on their faces, to know how the impact that I have left on them after coming in contact with them, whether it's in the hospital setting, whether I'm assessing patients in the, like I said, in the adult daycare, whether I'm assessing them in that setting, that's pretty much a reward to me. You do have your monetary factor that's also involved, and we can touch on that next. But rewarding to me is to see those when I walk in the door and they like, oh, it's the nurse, and they're excited, and so just being able to give back and educate them at the same time, and just kind of like leave them with a smile and a lasting impression after my encounter with those that I see in the setting that I actually go in to perform my assessments. So some of you might want to know, as an RN assessment, what the compensation is like. Well, the great thing about that is that if you're a contract RN assessment nurse, you basically set your price. You know what you're worth, you know your experience, you know what you bring to this field, so you can set your price. You have some people who are hired on through the particular facilities, and they have their own set price. But with you going in as a RN assessment nurse with your own business, you definitely can set your own price. All right, so if I had to share any type of advice to aspiring nurses, I would say, just like I told you in the beginning, stay organized. So I feel like organization, it helps to alleviate having to go back and double working yourself. So staying organized. I will also suggest reaching out to those who have more experience in that area. I found people on Facebook that I've became like buddy buddies with, just through the assessment field alone. I had questions, and I saw that I was in this group with other assessment nurses, and we just, I'll just grab one to the side and just kind of ask questions. And those who've had experience, way longer than I do, I definitely don't, with anything you do, even while you're in nursing school, as you're aspiring to become a nurse, or, while you're in school, or even after you become a nurse, when you have questions, always don't hesitate to ask. Seek answers from those who are a bit more seasoned than you, that have a bit more years of experience on you. So I'll go ahead and wrap it up here, just to end this with, for those of you who are, again, that are aspiring to become a nurse, just know that you could you could do anything that you put your mind to. And for those of you who just curious to know, like wanted to know what it was about, I hope I have answered some of your questions. If there are some things that I didn't answer in this video that you might want answered a little more thoroughly, drop those questions down below. And as always, if you haven't already, subscribe to the channel. Send this to someone who you think that they might benefit from this. Like it, share it, comment, and don't forget to subscribe. And as always, thank you for chiming in to your girl Nurse T. I'll see you on the next one.